Bismillahirrahmanirrahim. So guys, I have started this series on MCCQe1 preparation, and in this series now we are focusing on gynae and ops, gynecology and ops, and in ops we are going to study various emergencies that are most important in these tests. So the first thing that we are going to study is the hypertension. Hypertension is also known as the high blood pressure in the layman terms, and gestational hypertension refers to the pregnant women who are experiencing the symptoms of the high blood pressure. And there are various categories that we need to differentiate in order to understand the whole concept. So this is the brief overview video, and we are going to discuss these various category, how to differentiate them, and regarding to these scenario or any one of the disease, these come under the heading of acute medicine, acute emergency condition, obstetrical emergencies. And in these emergencies various questions can be asked in respect to these can be asked of the diagnosis, what are the investigations that are needed in order to confirm our diagnosis, and what are the steps of the management. These various steps can be, or various questions can be asked, moreover their complications can be asked. So regarding to gestational hypertension, it's the hypertension that is related to pregnant women or that pregnant women are experiencing. These are obstetrical emergencies. So how we are going to define it? Hypertension, so any blood pressure more than 140/90. We need to know this value in order to understand this concept, that it should be more than 140 or over 90 millimeters of mercury. And what is the time period after 20 weeks of the gestation? That is, their gestational age should be more than 20 weeks without proteinuria. So they are defining it, or they are specifying it more and more. Proteinuria means when there are proteins are released in the urine. Normally they are not excreted in the urine, so if they are released or excreted in the urine, it means that there is end organ damage. So without proteinuria, if there is proteinuria, it means that there is the kidney damage, and the condition refers to preeclampsia. So when we are going to define hypertension, it's more than 140/90 millimeters of mercury pressure, and it's after 20th weeks of the gestation. Unlike preeclampsia, in preeclampsia, as I have told, there would be proteinuria, there would be end organ damage, and it can the gestational hypertension, it can progress to preeclampsia. Management, how we are going to start, from where we are going to start, and what are the initial steps in the management. Firstly, it starts from close monitoring, and antihypertensives are started only if its symptoms get severe. What are the diagnostic criteria? You should know this value, that blood pressure should be more than 140/90 millimeters of mercury, and it should be on the two occasions. There is white coat hypertension as well, that is the patient is going to experience the high blood pressure when they are at clinic, or when the doctor is measuring their BP, they are going to have this high blood pressure on a single event. So in order to diagnose gestational hypertension, there should be high blood pressure more than 140/90 millimeters of mercury on two separate occasions, and these are 4 hours apart. This is the proper standard diagnostic criteria, and it should occur after 20 weeks of gestation. Before 20 weeks of the gestation, if a pregnant woman is experiencing high blood pressure, then it is known as chronic hypertension. If after 20 weeks of gestation, then it is known as gestational hypertension. And if there is proteinuria along with the hypertension after 20 weeks of the gestation, then it means that gestational hypertension has developed complication, and it has led to preeclampsia. In case of preeclampsia, there is proteinuria, there is end organ damage, maybe headache, maybe neurological deficits can be over there. So preeclampsia always and always is present along with proteinuria. What are the steps of the management? So in order of their severity, these BPs are divided, and they are managed according to their severity. If the blood pressure is less than 160/110, means more than 140/90, and less than 160/110, then we are going to usually do only lifestyle modification, that is increase physical activity, daily salt restriction and antihypertensives can be started in cases of severity in order to prevent the complications. In case of the severe blood pressure, we are going to start antihypertensive for sure. And in case of gestational hypertension, the antihypertensives are different from the usual antihypertensives that we are starting. So these antihypertensives in case of gestational hypertension, they are labetalol, hydralazine and nifedipine. And in case of gestational hypertension, there are chances of the fetal and maternal complications, so fetal monitoring should be done, like growth and well-being, because gestational hypertension is a cause of placental insufficiency and it leads to various stillbirth and various growth retardation and fetal abnormalities. So fetal monitoring is done and delivery should be done at 37 weeks if stable, and earlier if maternal or fetal compromise. So if there is fetal-maternal compromise, then delivery can be emergency delivery can be done before 37 weeks of the gestation, and the delivery should be done at 37 weeks of the gestation if stable. Now there are various practice MCQ scenario that I have included in these slides in order to make this concept more clear. So at 29-year women at 32 weeks of the gestation, you can see that whenever there are more than 20 weeks of the gestation, it means that gestational hypertension presents with BP 150 by 90 more than 140 by 90, so it's gestational hypertension. And there is no proteinuria, it means that there is no preeclampsia. So in this case, what is the diagnosis? Gestational hypertension. Chronic hypertension can be there if the gestational age is less than 20 weeks of the gestation. Preeclampsia can be there if there is proteinuria, edema, and eclampsia can be there if there are seizures or fits are present. So in this way, we are going to more specifically confirm our diagnosis and rule out other options as I've shown that. So this scenario is a clear picture of gestational hypertension. So in this way, you can be asked of the diagnosis. Now I have another scenario. This is a 34-year-old woman at 38 weeks has a BP 165 by 110. So BP is more than 140 by 90 and there is no proteinuria, and moreover she is at 38 weeks of the gestation. So what is the best next step? We need to lower down the BP in order to avoid complications. So we will start antihypertensives. As the BP is more than 140 by 90, so we need to start this. And we also have studied that if the BP is more than 160, then we should start antihypertensive. If it is less than 160, then we can reassure her and follow up. Otherwise, we need to lower down the BP. A 26-year-old woman with gestational hypertension at 37 weeks, BP 140, 150 by 95, no proteinuria, fetus is stable. What is the best management? So what is the key point here? Fetus is stable. So we can induce labor at 37 weeks of the gestation. Okay, we don't need to start magnesium sulfate as there is no proteinuria. In case of preeclampsia, we need to start this prophylaxis in order to prevent eclampsia. And if patient is stable, her fetus is stable at 37 weeks of gestation, that we can induce labor. We no need to rush towards the cesarean delivery unless there is any complication. In case of complication, we will go towards the cesarean delivery. So this is the whole concept of the gestational hypertension. When a pregnant woman is experiencing hypertension, high blood pressure more than 140 per 90 after 20th weeks of the gestation with no end organ damage, no proteinuria, then it is known as the gestational hypertension. Gestational hypertension has following other sub branches as well, known as preeclampsia and preeclampsia and eclampsia, and we have got a brief review about them. That is, preeclampsia is the condition when there is proteinuria, end organ damage, headache, visual changes, or edema, generalized body swelling, and eclampsia is present in case of the seizures as well. So the questions can be asked. What questions can be asked? Questions can be asked regarding to their diagnosis, management, and investigations, and more questions can be asked about investigations as well. This was the brief review about gestational hypertension.